Good morning. I'm Tom Inglesby from the Center for Biosecurity of UPMC, and welcome to everyone. And to our distinguished guests and friends from China, Yo Peng Zhu, Yuan Feng Lai, Bui Lei Hu, which in English is, we are honored and happy that you've come from so far away to join us for this meeting today. In February this year, President Obama said it's absolutely vital that we have a strong relationship with China. At that same time, in his visit to Washington, Chinese Vice President Xi Jinping said he hoped his visit would deepen mutual understanding and friendship between the two great powers. And today's meeting is intended to do just that, to strengthen the relationship and deepen mutual understanding between the U.S. and China in our efforts to prepare and respond to pandemics and epidemic disease. As we'll hear about more today, our two countries have had substantial successes in collaborations on prevention, detection, response, and control of infectious diseases. Strengthening partnerships and collaborations in pandemic preparedness is a critically important challenge for both of us, both countries. We all know that pandemic and epidemic disease is a serious global threat. None of us in the room will forget the terrible toll of SARS in 2003 and 4, the way it spread like fire from country to country, the fact that one case, a super spreader, could lead to so many others in so many countries, that doctors and nurses and laboratory scientists were among those who lost their lives, an ominous and terrible sign of contagion and lethality, the absence of a treatment and a vaccine, the many who died, and the global relief when isolation and containment finally brought SARS to an end. And years later, when our surveillance systems were focused elsewhere, we in the US were surprised by the 2009 H1N1 appearing at our doorstep in Mexico. At the way it spread quickly to the US and elsewhere in the world, we developed large supplies of vaccine, though we needed it to be faster. There was a belief by too many in the US that the vaccine was experimental. There were varying views on how to stop the spread within the US. States took varying approaches, and some political leaders were accused of being not aggressive enough in fighting H1N1. There was increased lethality in pregnant women and children. But with the wisdom and data of hindsight and the annals of time, it will go down as modest, a modest epidemic. But it gave us a glimpse of the kinds of problems that a more severe pandemic will bring to us in the future. And we know we face a continued danger in H5N1. Millions of birds infected, hundreds of people diagnosed with H5N1, the WHO database with a case fatality rate of 60%. Fortunately, it hasn't been transmissible from person to person, very efficiently anyway. But should this virus ever become readily transmissible between people, we would certainly face a catastrophe. Future epidemics and pandemics can lead to many kinds of dangers. They can sicken and kill extraordinary numbers of people. They can make people afraid of their neighbors. They can lead to shortages where not everyone can get the same vaccine or medicine or access to health care. They could lead to extreme economic hardship. A World Bank estimate of the global economic impact of a 1968-like pandemic with a case fatality rate of only 1 in 1,000 was $3 trillion of losses in a year. So the economic implications for the two biggest economies in the world, China and the US, could be severe. All of which is why we have to prepare to deal with pandemics. We have to work hard to discover pandemics as early as we can, to anticipate the havoc that they'll cause, to work to lessen their consequences, to be ready to develop medicines and vaccines, be prepared to isolate the sick and to treat large numbers of people, and get set to vaccinate quickly. So the purpose of this meeting today is to have leaders and experts from China and the US describe some of their important work to prepare for and respond to epidemics in these two countries. We want to learn from each other. We want to identify areas where we can collaborate and work together. We want leaders in the US to understand the challenges facing Chinese experts on these issues, and we want Chinese leaders to understand the same from their US counterparts. So let's develop and deepen these relationships with each other now, before the next pandemic, and let's see how we can help each other ahead of the next disaster, so we'll be all the more ready when the next crisis strikes. Because while government programs give us all that we need, or give us what we need, not all that we need, but what we need to organize our responses, nothing is more important than personal relationships between professionals in times of crisis. We have a great meeting set for you today. We're going to hear from virus hunters from the US and China who are out looking for evidence of new epidemics and sequencing new pathogens. We're going to hear about making new medicines and vaccines. We'll learn about lessons from Wenchuan and Katrina. Leaders from the China CDC, US CDC, and US Health and Human Services will tell us about their plans for preparing for the next pandemic. And we'll learn about the efforts of two of the world's greatest cities to prepare for pandemics, from two friends who used to work together in China, but who now run their respective programs in New York City and Shanghai. And we're very fortunate to have General Brent Scowcroft to give a keynote address. He's one of the leading and wisest figures in the US as it relates to understanding and valuing the long-term US-China relationship. So we would encourage your participation throughout the day. In all of our talks and panels, there'll be time for questions and comments, and we'd really welcome them. At lunch, we're going to pick up lunch in the other room and bring it back and listen to our panel discussion on Wenchuan and Katrina. In the afternoon, we'll have one session with simultaneous translation, and we'll explain how that will work when we get to that session. And after the meeting concludes this afternoon, we'll invite you all for a reception upstairs to the top floor. And so let me finish with the Chinese saying, which is, 习在人为. As long as we don't give up, we can get it done.